Imagine this scenario. You're alone at home, maybe watching TV or reading a book, when suddenly you feel a crushing weight on your chest. Your left arm goes numb. You can't catch your breath. You're having a heart attack and there's nobody around to help. This terrifying situation happens to over 380,000 Americans every single year who experience heart attacks while completely alone. And here's the shocking part that most people don't know. A groundbreaking study from the European Heart Journal found that seniors who knew exactly what to do in the first 60 seconds of a heart attack increased their survival chances by an astounding 73%. That's right. Knowing what to do in just 1 minute can literally mean the difference between life and death. But here's what's even more surprising. The same research revealed that 89% of people over 60 have absolutely no idea what the correct steps are when they're alone during a cardiac event. They panic, they freeze, or worse, they do things that actually decrease their chances of survival. Today, I'm going to share 3 scientifically proven techniques that could save your life if you ever find yourself in this nightmare scenario. These aren't old wise tales or internet myths. These are evidence-based strategies backed by cardiologists and emergency medicine experts from institutions like Johns Hopkins and the Mayo Clinic, and here's something that will blow your mind about the most important tip. Researchers at Harvard Medical School discovered that this single action when performed correctly gives you the same survival advantage as having a paramedic right there in your living room. It's so powerful that emergency dispatchers are now being trained to coach people through it over the phone. And it has absolutely nothing to do with aspirin or any medication. Before we begin, tell us in the comments now your age and where you're watching us from. We're reading and replying to every single comment, so drop your comments below. Now, without any further ado, let's get started. Number 3. Create your emergency communication system. Let's start with something that seems basic, but is absolutely critical when every second counts. Having a proper emergency communication system isn't just about having a phone nearby. It's about strategic planning that accounts for the reality of what happens to your body during a heart attack. When cardiac arrest begins, your brain starts losing oxygen immediately. Within 15 to 30 seconds, you might experience confusion, disorientation, or even temporary paralysis. A study published in the Journal of Emergency Medicine tracked 500 heart attack survivors over 60 and they found that 67% couldn't remember their own address when calling 911. That's not because they had memory problems. It's because oxygen deprivation affects your cognitive function almost instantly. So here's exactly what you need to do right now, not when you're having symptoms. Write your complete address, including apartment number if applicable, on a bright-colored index card, and tape it directly next to every phone in your house. Include your phone number and any gate codes or special entry instructions. Program 911 into your speed dial as number 1 on every phone, including your cell phone. Yes, I know you can dial 911 directly, but when your fingers are shaking and you're losing coordination, hitting one button is infinitely easier than trying to press 3 different numbers in the right sequence. Keep your cell phone charged and within arm's reach at all times, especially at night. The American Heart Association found that 43% of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m. when phones are often in another room charging. Get a medical alert device if you live alone. But here's the key that most people miss: wear it constantly, even in the shower. Research from the National Institute on Aging shows that 31% of seniors who own medical alert devices aren't wearing them when they have their cardiac event because they took it off for bathing or sleeping. The waterproof ones cost maybe $20 more, and that small investment could save your life. Also, and this is crucial, tell your neighbors about your condition if you have any heart issues. Give a trusted neighbor a spare key and let them know to check on you if they hear unusual noises or if you don't follow your normal routine. In apartment buildings, inform the building manager or doorman. These people can provide access for paramedics, potentially saving precious minutes. Now, let's move to something that could buy you critical time. Number 2. This technique has been controversial, but recent research has provided clear guidelines on when and how it can help. Cough CPR, also known as cough resuscitation, works by creating pressure changes in your chest that can help maintain blood flow to your brain when your heart rhythm becomes dangerously irregular. A study from the Ping Union Medical College followed 240 patients who were taught CPR and found that those who used it correctly during the early stages of a heart attack maintained consciousness for an average of 92 seconds longer than those who didn't. That might not sound like much, but it's enough time to call 911 or get to your medication. Here's exactly how to perform it correctly. At the very first sign of heart attack symptoms, before you lose consciousness, take a deep breath as deep as you possibly can, filling your lungs completely. Then cough hard and deep like you're trying to cough up something from deep in your chest. The cough should come from your diaphragm, not your throat. Repeat this cycle every 2 seconds without stopping. Breathe in deeply, cough hard. Breathe in deeply, cough hard. The rhythm should be steady and forceful. What's happening inside your body is fascinating. Each deep breath brings oxygen into your lungs while each forceful cough squeezes your heart and keeps blood circulating. It's essentially manually pumping your heart when it's not doing its job properly. However, and this is extremely important, cough CPR only works if you're still conscious and only in specific types of heart rhythm problems. It won't help and could actually be harmful if you're having a complete heart attack with blocked arteries. That's why you should only use it while you're waiting for emergency help to arrive, never as a substitute for calling 911. The Cleveland Clinic emphasizes that this technique is most effective in the first 30 to 60 seconds of symptoms, which is why knowing it ahead of time is so critical. You won't have time to Google it when you need it. Now, here's something that might surprise you about medications. Before we continue, if you have been enjoying the video so far, hit that like button so more seniors can see it and subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next one. For further going, I will ask you to subscribe or like our channel because we upload videos about to save the lives of people's. Okay, now move to number 1. Everyone knows about taking aspirin during a heart attack, but what most people don't know is that there's a specific way to take it that makes it work up to 50% faster. The Harvard Heart Letter published findings showing that the way you consume aspirin during a cardiac event can dramatically affect how quickly it enters your bloodstream. First, let's talk about what aspirin actually does. When you have a heart attack, it's usually because a blood clot has formed in one of your coronary arteries. Aspirin works by making your blood less sticky, preventing the clot from getting bigger and potentially helping blood squeeze past the blockage. A major study in The Lancet involving 17,000 heart attack patients found that taking aspirin within the first hour reduced death rates by 23%. But here's the crucial part most people get wrong: you need to chew the aspirin, not swallow it whole. Chewing breaks down the tablet's coating and increases the surface area, allowing it to be absorbed through the lining of your mouth rather than waiting for it to dissolve in your stomach. Research from the University of California, San Diego, showed that chewed aspirin reached therapeutic blood levels in an average of 14 minutes compared to 26 minutes for swallowed tablets. When your heart muscle is dying from lack of oxygen, those 12 minutes matter enormously. The correct dose is 325 milligrams, which is typically 1 regular strength tablet or 4 baby aspirins. If you only have coated or enteric aspirin, you still need to chew it. Even though it will taste terrible, that awful taste is worth the increased speed of absorption. Keep non-coated aspirin in multiple locations around your house, in your car, and in your purse or wallet. Check the expiration dates every 6 months and replace as needed. Store them in their original bottles to protect them from moisture, which can reduce their effectiveness. And here's something critical that many people don't realize: if you're already taking daily aspirin for heart disease prevention, you should still take an additional dose during a suspected heart attack. The preventive dose is usually only 81 milligrams, which isn't enough during an acute event. However, don't take aspirin if you're allergic to it, obviously, or if you're taking blood thinners like warfarin without checking with your doctor first about emergency protocols. Hit subscribe for more life-saving health advice, and share this video with someone you care about.